Good morning, everyone, and thank you for being here. Welcome to a community conversation about addressing homelessness, hosted by Our Path Home, which is the public-private partnership of more than 40 organizations working to end homelessness in Ada County, and also hosted by the City of Boise, the lead agency for Our Path Home. My name is Ellen Campfield-Nelson. I'm a local business owner and someone who also cares, like you, about ending homelessness in our community. And I'm delighted to be here with you all. This morning, we'll start by hearing from a panel of very knowledgeable and committed community leaders who have been working to end homelessness in our community. And I want to thank and acknowledge them for being here to share that knowledge and experience. I also want to thank and acknowledge all of you, our community members who have joined us today over YouTube and who join us in many other ways in this cause through your donations, volunteerism, desire to be educated and engaged in this issue. We appreciate you being here and being part of this community conversation. I also want to acknowledge and thank Lavana, who is our ASL interpreter. We will be turning cameras on and off as each of the speakers speak this morning in order to provide better understanding and access and interpretation of ASL. So thank you everyone for doing that camera on and off and for understanding. I also want to mention, I believe this conversation is live streaming and being recorded and can be available afterwards. This will be a 45-minute panel followed by breakout conversations in smaller groups with our community leaders. With that, I'd like to turn to our panel and we'll call on each of them in turn to introduce themselves. And may I start by acknowledging Mayor Lauren Mclean. Mayor.
Hi, Ellen, and hi, everybody. Thanks so much for joining us today. I really look forward to this conversation because it's an opportunity, one, to share our vision for a home for everyone, but two, to talk about the important services that each of the organizations related to Our Path Home provides to members of our community. And first and foremost, to remind ourselves that as Boiseans, we value taking care of each other, ensuring that everyone has a home from which to build a life and create opportunity for themselves and their families. And ultimately that we come with compassion to address these tough issues in our community and the belief that we can do it. And so really look forward to the panel and to jumping in and saying hi during the breakout session today. I want to thank everyone for the time you're taking to join us and the time that went into putting this together. And of course, the service you provide our community.
Thank you very much, Mayor. And I'd like to follow the mayor by inviting B. Black to introduce herself. Thank you, B.
Thank you very much, Ellen. So B. Black, I'm the CEO of the Women's and Children's Alliance. I'm also a member of the Our Path Home Executive Committee, where it's been my privilege to serve for many years. Homelessness is unfortunately a byproduct of a lot of abusive relationships. So it is a very important issue for our clients. And I'm just very pleased to be able to be part of this important meeting this morning and appreciate the time that everybody's taking to learn more and to participate. Thank you.
Thanks very much, B. Next, I'd like to introduce Andrea Roop, who is one of the tri-chairs of the Campaign to End Family Homelessness and another leader in this space in our community.
Thank you. It's really wonderful to be here. I'm Andrea Roop. I'm with the Pacific Companies. We are a affordable and market rate multifamily housing developer in the Valley and elsewhere in the West. We are also a partner in Our Path Home, proudly working to house families who are experiencing homelessness in our market rate and affordable developments throughout the Valley. And it's really wonderful to be partnered with Tommy Alquist and Tracy Liebeck as we launch this campaign for $8.6 million to end family homelessness in Ada County. We're very excited to be a partner here. Thanks for having me.
Thank you so much, Andrea. And next, I would like to introduce Jennifer Pelagi.
Good morning. Hi, I am Jennifer Pelagi. I'm the Vice President for Community Health and Wellbeing at St. Alphonsus Health System. I am also a nurse, and in the work that we do in community health, we have a large focus on housing and homelessness, and that being a root cause and influencer on health itself. So we'll talk more about that later.
Thank you very much, Jennifer. And then I'd like to turn to Teresa McLeod, please.
Good morning. I'm Teresa McLeod. I have the pleasure of being the interim administrator for St. Luke's Community Health and Engagement. As part of our mission, St. Luke's desires to improve the health of people in the communities we serve. And that ties us very strongly to working with Our Path Home and all of our community partners around ending homelessness. We, as a funder through our community benefit, really strive to have an impact financially with all of the agencies in Our Path Home. And to Jen's point, we'll talk more about that later. Personally, I've been involved in matters of housing and homelessness my entire professional career, whether I was in the private sector or in municipal government with the city, and now in healthcare. Thank you very much for having me.
Thank you so much, Teresa. Next, I would like to invite Senator Robbie to introduce herself. Good morning.
Good morning. My name is Robbie. I'm the executive director at Jesse Tree, which is dedicated to preventing eviction and homelessness and housing loss of any kind from happening to our neighbors and to our community. And we're really excited about all the collaborations we've been working on with the partnership over the last 2 years in aligning our approaches and programs to better serve families and potentially end homelessness for Ada County and for Boise.
Thank you very much. And next, I'd like to ask Chief Ryan Lee to introduce himself, please.
Thank you for the introduction. Good morning, everybody. It's a pleasure to be here. I'm Ryan Lee. I'm the Chief of Police for the city of Boise. I'd like to thank everybody for this opportunity to engage in this conversation, in this space. I think when we're talking about people experiencing homelessness, it's important for us to recognize that we're dealing with people that are living their private lives in a public space. And frequently, some of those challenges wind up putting them in connection with police services, not necessarily in anything other than a welfare check capacity. And I need to be engaged in this space, as do all of my officers, to make sure that we're providing and connecting people with the best services so this is a safe and livable community for all of our citizens and all the people that live here, regardless of their housing status. So thank you very much for having me here today.
Thank you, Chief. Next, I'd like to introduce Stephanie Day. Good morning, Stephanie.
Good morning. Thank you so much for being here, and thank you for letting us be a part of this conversation. I'm the Executive Director of Catch. We are a local nonprofit that's working on making sure that home is a reality and an option for every single person in our community in the Treasure Valley. So thank you so much.
Thank you, Stephanie. And I think I'll stick with Catch and ask Jeanette and then Sarah Busick to introduce themselves, please.
All right, thanks, Ellen. So I am Jeanette Curtis. I'm the director of our homeless outreach team. We just started about a year ago, and our role in the system is to connect with people who are experiencing homelessness out in the community who may be disengaged or disconnected from services. So we go out where people are, we get to know them, we learn about their circumstances that might have brought them into homelessness. And then we do a lot of problem solving with them to find the fastest solution to get them off the streets based on whatever their circumstances are. And we work closely with all of the other agencies within the partnership to provide those resources and supports that they need. I'm excited to be part of this roundtable today.
Thanks, Jeanette. And Sarah, do you mind jumping in?
Yeah, hi everybody. My name is Sarah Busick and I am the program director for Our Path Home Connect. And our main focus is really acting as a funnel. So we want to catch everybody who's coming into homelessness in Ada County, and we want to help direct them to the resources that are going to help them resolve their housing crisis in the quickest way possible, just to keep them safe and keep them out of that trauma and that crisis. The other thing that Our Path Home Connect does is that we do focus on maintaining our partnerships at a kind of a boots on the ground level. So I'm working with our partners who are working directly with clients to collaborate and get our clients what they need as quickly as they can. And that's who we are. Thank you.
Thank you, Sarah. And next, I'd like to call on Deanna. Deanna, can you please introduce yourself?
Thank you. Yes, I'm Deanna Watson, and I'm the Executive Director of the Boise City and Ada County Housing Authorities. And we provide housing assistance through programs and properties dotted around the city and in different formats. The largest program that we administer that is commonly referred to as Section 8 or Housing Choice Voucher Program, but we also have permanent supportive housing programs and some high rises for providing housing for elderly and or people with disabling conditions in 3 spots in the downtown core area of Boise. I just so appreciate the spotlight and focus that we are putting on the challenge of homelessness. And as Teresa McLeod said, I've spent most of my career in this field, and it's a daunting task, but it is made easier when we all pull together, and just appreciate this opportunity.
Thank you very much, Deanna. And I believe the last panelist I want to ask to introduce themselves is Maureen Brewer.
Good morning, everybody. Thanks for having me. My name is Maureen Brewer. I am the Senior Manager of the city's Division of Housing and Community Development, and I am also still currently serving as the Administrator or Manager of the partnership, Our Path Home. So making sure that partners stay connected, that we comply with our federal regulations, that we leverage various fund sources, and that we continue to work together as a team.
Thanks, Maureen. Great. Well, thanks to all the panelists for being here. And I think I'm just, as always, impressed by the strength of the partnership, the variety of the folks involved, and I'm looking forward to getting into some questions with all of you on the topic of ending homelessness in our community. I would like to invite members of the community who have joined us on YouTube to write any questions they might have in the chat or message fields of YouTube. That is being monitored by the city team. And if we have time for some of those questions, we will certainly bring them into this conversation. And regardless of whether or not your question is asked, we definitely do want to hear from you. Speaking of community questions, our questions today for the panelists are ones that have come out of the community that we've received from community members. Some are paraphrase for brevity and to ensure we can get through as many questions as possible in our time together. So we hope that you find these questions match the ones that you have, and that they give a good explanation of what Our Path Home and the City of Boise are doing to help end homelessness. So before we talk about the plans and the data and all of the monitoring and work that goes on, we wanted to start by speaking with who are the people in our community, our neighbors and community members experiencing homelessness. And for that, I'm going to first turn to Bea and Jeanette and Sarah to speak to us about who experiences homelessness in our community. Bea, would you like to start us off?
Sorry, just trying to get my video on, Ellen. Thank you very much. Yes, I'd be happy to. So one of the issues that we have with our women and children that stay in our shelter, when they are ready to move out, that is a very tough challenge for our case managers, and helping them find a place to move to that is affordable and is appropriate for them is an ongoing issue. What we have found over particularly the last 12 to 15 months, is that the number of families, women and children who have come to us has greatly increased because of the pandemic. So when you take the fact that domestic violence is the #1 cause of homelessness for women and children, it has only been exacerbated in the last 12 to 16 months. And so it's made me extremely grateful to be involved in the Our Path Home Executive Committee, to have the partners that we have around the table, because frankly, this is the only and best way for us to help them as they move forward in their journey to find housing. So it has been on the rise for several years, but it has really been exacerbated in the last few years. The average individual moving into our shelter is a mom who comes with 2 to 3 children, and they tend to be under the age of 5. So that, I hope, helps give a little bit better perspective on what at least we have seen with respect to the face of homelessness in our community. Thank you, Ellen.
Thanks, Bea. Next, I'd like to ask Sarah to give her response to that question. Thanks,
yeah,
Sarah.
for sure. So what we see, so the cool thing about being a part of Our Path Home Connect is that we intake a lot of data. So every person that comes in to see us is, we're collecting data on them. So kind of what we see coming through the door right now, about half of the folks that we serve do have some sort of disabling condition. Many of those are a severe and persistent mental illness. So that creates a huge barrier to housing for them, just due to the difficulties in navigating the system, not only the homeless services system, but just the system now that is required to, say, apply for an apartment. So those folks need, a little bit of assistance. We've got 60%, a little over 60% actually, of the folks that we see at Our Path Home Connect do bring in some kind of income. And we're seeing that number go up. So what we're seeing is more people coming into the system who do make an income. It's just not enough to sustain them. One of the other things that we're seeing, and this has come about, I believe, as a result of the pandemic, is that and our housing crisis, right? So we've got a big bottleneck. So year over year, so 2019 and 2020, we brought in almost the same number of families. We assessed them, for various housing programs. The issue, though, is that our waiting list for programming has almost double, to be quite honest. About 100 more families are waiting for interventions because when they come into the system, we can't get them back out into housing quickly enough. Research tells us that outcomes are are really good for people who can get out of homelessness between 0 and 24 months of homelessness. And we right now, our average length of time waiting in homelessness before accessing programming is about 20 months. So we're getting really close to a tipping point. And we really want those great outcomes for our families and individuals experiencing homelessness. So we'd really love to be able to get them back out into housing more quickly. I think that is my main, that's what I've got. We're also seeing a lot more elderly folks. They're overrepresented in our homeless population. These are our grandparents that are having to live in shelters and on the streets.
Thank you, Sarah, for adding to what Bea had already said. And I'd like to, end with Jeanette, who maybe can tell us a little bit about like what you see day to day, Jeanette, and just speak to the people that you work with directly.
Sure. It's a really important question, so thanks for asking that. So on the outreach team, we work with anyone who's experiencing homelessness, but we really prioritize our work with adults who are experiencing what we would call unsheltered homelessness. And so for us, that means people who are literally living on the streets, or some who may have set up camp somewhere along the Boise River. Lots of folks in Boise these days sleeping in cars or RVs around town. So those are the folks that we spend most of our time working with. We are able to get a lot of them connected to our emergency overnight shelter systems. So Interfaith Sanctuary or Boise Rescue Mission, once we engage with them and kind of talk to them about what that experience is like and get them connected. But there are also a lot of situations where people either choose not or they cannot stay in a shelter situation. And so outreach works with those folks wherever they might be staying around town.
Thank you, Jeanette. And next, I would like to ask Maureen Brewer to speak to us a little bit to kind of, we painted a picture of kind of some of the neighbors and community members who are experiencing homelessness. Can you talk to us a little bit about the data and the numbers and what we've been seeing over the past few years and where we're at today?
Absolutely, Ellen. Thank you. You know, I think this question makes people a little bit uncomfortable because it's hard, if not impossible, to really put a fine point on how many people are experiencing homelessness within the city of Boise and Ada County. So what we have to do is triangulate a number of data points and settle on something not unlike a confidence interval where we kind of get a range that we can feel comfortable with in terms of how many people are experiencing homelessness. So we primarily look at 3 different data points and the trends associated with those. One of those is the Our Path Home Connect queue that Sarah Busick manages. This morning, there are 701 households on that queue. Most of those households, over 400 of them, qualify for permanent supportive housing, and then the balance qualifies for something called rapid rehousing. It's another form of supportive housing. It's just time limited. But to kind of put this in broader context for you, that's this morning's number. In 2020, 695 households were entered onto that queue. So they were entering the system through Our Path Home Connect. And then we had an average of 835 households active on the queue at any given time throughout 2020. So of course there's carryover, between years. Also in 2020, we had over 2,000 people over the course of that year active in emergency shelter. So that shelter number can be a little bit harder to track because although we know more or less how many people are in shelter each night, tracking unique individuals can be tough as people navigate their situation. So for example, they might be able to bunk up with a friend for a couple weeks. They might be able to access a hotel for a few nights, and then they come back to shelter. There's also been a lot of recent interest in the PIT count that we held in January, and I have those numbers as of this morning. They're preliminary. So HUD, Housing and Urban Development, just opened our federal reporting system yesterday. So these are preliminary numbers until we upload and report to the federal government. And then I'll also just mention that the key with the PIT is that we have to look at a trend. So going back 5 or so years, we've been in kind of that 650 to 850 range, pretty steady. For this year's PIT count, so 2021, we counted 410 people in emergency shelter, 73 people that were unsheltered on the night of the PIT, and then 69 people were in a transitional housing bed on the night of the PIT count. So that's 552 people, unique individuals that were experiencing literal homelessness on the night of the PIT count. And then we had 583 individuals that were in what we could call a supportive housing unit or bed. 152 were in rapid rehousing, and 431 were in a permanent supportive housing bed. The take home, though, that I'd sort of just like to point out to kind of round out how many people are experiencing homelessness in Ada County and what do we know about that number, really the take home is that obviously there's more people experiencing homelessness in Boise City and Ada County right now than the partnership has the capacity to serve. So we have a mismatch between the capacity of the system to rehouse people quickly and just this general situation or circumstance right now where our path home is under-resourced, generally speaking, and it's also heavily affected by outside factors. So namely, the cost to rent a unit and get that at an affordable rent, the vacancy rate, and also wages.
Thank you so much, Maureen, for giving us that important data. And I do want to applaud the Our Path Home system because I know that over the last several years, there was a really big effort extended to understand that data more deeply and the numbers so that we know in real time how many folks are experiencing homelessness within Ada County. I'd like to build on that question and turn to Mayor Mclean and ask, Our Path Home is a partnership, and we know that complex issues like ending homelessness require that kind of collective impact of many partners coming together. But the city also has been a leader in this space and continues to be. And many people do ask, what can the city do? What can the city not do? So I want to ask the mayor to speak a bit to your vision for addressing homelessness in our city and the role that the city plays.
Well, thanks, Ellen, for the question. It's a really important question, but an important conversation that is taking place in this community and helping shape the vision that we have as a city that has always and will always remain housing first. We talk about the importance of ensuring that Boise is a place for everyone, that everyone has a home from which they can build their lives. And even as we address the tough issues around homelessness and we seek to support those experiencing homelessness, as a city, our long-term goal is housing first and to ensure that everyone has a home. And to do that, there's so many different pieces that are required. And so I want to talk, we mentioned the vision, which is housing first. And there are great examples in the community that I can touch on. But the values that we as Boiseans bring to this work include our commitment to taking care of each other and the belief that we have to have a safe, healthy, and clean community, that housing is an important foundation from which to build a life, and that we'll do this in service in partnership. And Boise for so long has shown that we can do tough things. And I'm really optimistic that we've learned from the pandemic the importance of addressing emergency needs. We've learned from the pandemic that people will come together in partnership to address those needs, but then to do more and to reimagine what housing and support for people within this community looks like. And that we can get ahead of the problem related to housing and homelessness because it's still at a scale where we can tackle it if we're creative. And so as a city, what we seek to do is ensure that we, and first by supporting the Our Path Home partnership, we can make good on the things that we want to accomplish. And the first off, of course, is to prevent homelessness. We've invested in Jeanette and the teams of people that Jeanette works with to ensure that we can meet people where they're at on the streets to provide them with the services they need to move into shelter. And our goal is ultimately into home. That's the service piece, not the prevention piece. We've invested in Jesse Tree and other organizations to help keep people in the houses they have now. Because that's the single most effective way to prevent homelessness and to tackle the problem is to keep people housed. And then, of course, there's an emergency need with shelter for those that are needing shelter immediately. But then we've worked with great partners, including the hospitals represented today, many of the organizations represented today, and financial institutions to build permanent supportive housing, such as Valor Point and New Path. And we know that we need to do more of that and have deep, deep commitment from the City Council to join and share in this vision of Housing First, but to join in the partnership required to take the steps necessary to start providing more housing.
Thank you so much, Mayor, and thank you especially for your continued commitment, the city's continued commitment on this issue. I'd like to next turn to Chief Lee. We've received several questions that are centered around safety and specifically how we as a community respond to a person in crisis. What role does the Boise Police Department play in ensuring the health and safety of community members? Thanks, Chief.
No, thank you for the question. I think the first thing that we have to recognize is when we talk about individuals in crisis, there's a myriad of different reasons that somebody may be at a crisis point in their life. It can be everything from economic strain occurring that's maybe making it challenging for them to pay rent, to buy food, to long-term underlying mental health or addiction-related issues. There's a wide myriad of different challenges that cause a person to be in very acute crisis. Police are frequently tasked with responding to those events when the public sees somebody in crisis. We've gone through and trained all of the members of the Boise Police Department to have 40 hours of crisis intervention training. What's significant about that is the 40-hour mark of crisis intervention training is what most police departments in the nation use as their standard to develop specialized teams to respond to people in crisis. We've set that as a standard of training for every member of the department. We've rolled that out to everybody. It's being integrated into all of our police academies. So we're doing the best we can to equip our officers with the most tools and most relevant training to help deal with people in crisis during those contacts, with an emphasis on compassion and de-escalation and finding a safe resolution for everybody. The reality is that when people call the police, they're faced with a situation that's tumultuous and they're asking for us to show up as leaders in the community and help lead people to the most stable outcome and safest outcome we can find. And that's the role which the officers take and approach each situation with. We've also built out a behavioral health response team so that if the underlying cause of the person in acute crisis has to do with mental health related conditions, we can try to connect them with many of the partners that we have on this panel. We can connect them in a moment when they're not in acute crisis for a long-term resolution for them, a more productive infrastructure to help them get the help that they need to be able to have a life that doesn't require interfacing with us or the police service as much. We're also investing in building out a services coordination team so that if the underlying condition happens to be addiction related issues, knowing that that is a prime driver, that we're equipped pairing experts in the field along with police services to direct people so that they can get, again, connected with the right services to produce the most productive outcome for them. Fundamentally, police respond to these issues as problem solvers, trying to balance out the interest of the public at large with the individual in crisis. But we connect with a variety of different groups, from our neighborhood contact officers to everybody down to the patrol officer, in a proactive approach as well to connect them with services. And frankly, the police are arguably the largest, most visible arm of the city government, and our ability to work in partnership to connect with the long-term service providers, again, many of the colleagues here on the call, is really the approach that we take towards the end with individuals experiencing crisis, or being perceived by other members of the community as to being at a point of crisis.
Thank you so much, Chief Lee, and thank you for the role that BPD plays in responding to people in crisis in our community and to ensuring our health and safety. Speaking of health and safety, I did want to turn to both Teresa McLeod and Jennifer Pelagi, who spoke a little bit about the roles that St. Alphonsus and St. Luke's play within the partnership. The health systems have been incredibly strong and committed partners. Could each of you share why your institutions are so invested in collaborating on and addressing ending homelessness in Ada County? And I'll ask Teresa, please, to start. Thanks.
Thank you, Ellen. One of the main reasons St. Luke's is so involved is that we recognize many of our homeless community members are receiving their care through our emergency departments, which is not the right level of care that they need. It's not the right time, and it's definitely not the right place for them. It isn't something that is especially convenient for them. And it isn't our primary care physicians who will be able to support them in a better way. So if you also consider emergency departments, that's the most expensive interface in a health system. So for two reasons, there are many reasons, but two primary reasons, we believe everyone deserves the right care at the right time, at the right place. And in looking at that, where are our homeless members? How can we support the continuum of care so that there's emergency shelter, transitional shelter, permanent supportive housing, and who are those organizations in our community that are most positioned to be able to take care of the needs of our homeless community members? We agree completely with the mayor that the very best role that we can all place is how to ensure community members are housed. Everyone deserves to have a roof over their head and to have the kind of care that they need, the level of care, whether it's healthcare, whether it is employment assistance, childcare. And so St. Luke's really views this as not only the right thing to do, but absolutely the most critical humanitarian thing to do. So we have greatly appreciated, because we're not experts in this, while we have the ability to provide funding as part of our community benefit obligation as a not-for-profit, we have the opportunity to provide grants to many of our partners on the panel today that are experts, and they're positioned in the community to provide the care and the support that is needed. So we feel so fortunate that we have a role to play, that we can play it, and it's mainly because there's such an incredibly strong continuum of care in our path home. Thank you so much, Ellen.
Thank you, Teresa. And yes, Jen, can you speak to the same question, please?
Sure, I'll just add on to my colleagues' comments, Teresa over at St. Luke's. One thing I like to lead off with is that our health systems, the local ones, the largest ones being St. Alphonsus and St. Luke's, but additionally thinking about Terry Riley Health Services and the Family Medical Residency and others, we really work closely together to address issues that are deep-seated issues within the community. And so where sometimes the community can see us only as competitors, we are actually very, very strong partners when it comes to addressing the needs of people who are most underserved in our community. So that's where we want to make sure that we highlight for the community that we work together. One of the ways that we work together, every 3 years, at least, we do a community health needs assessment, and we do not do that in a vacuum. We do that with our partners across the valley. And I think what we've seen happen over time is that now the number one health need in the community is affordable housing and homelessness. And it's not just in our community, it's really an epidemic across communities. And so when we do that assessment, we have an accountability to our communities to address the top needs. So we are diving deep and going wide in the ways in which we do that, because we are caregivers and we are partners to all of those organizations you see on the screen here and others as well. And we're also a funder, or give community contributions like Teresa was talking about, to do social impact investing as nonprofit health systems. It's our duty and it's our great honor, and it speaks to our mission to be doing that kind of social impact investing and working with our partners to design new ways of addressing these really hairy issues like housing. So a couple of ways that we do it, that we work on this at St. Alphonsus, besides in partnership with others, we have a couple of special things going on right now. One is that we have stood up a social care hub, which includes a phone line and an email. Our social care professionals work with our clinical professionals to address those social influencers of health that include housing issues. So we have to go further upstream and stay in relationship longer with patients, because the time that they have in a clinic with a doctor or a nurse can be so very brief. But the things that they need to address besides diabetes or heart issues have to do with housing or childcare or safety. And so our social care hub that is staffed by community health workers help us do that long before a patient comes to a building and long after they leave one. And then additionally, we are working on a number of affordable housing and homeless projects across our footprint. And of course, the one that we're focused on today with Our Path Home and ending family homelessness is right there at the top. So that would be some of the highlights. Again, we've worked together with other health partners and these partners who are here with you today over time. Allen Bauhaus with detox and a housing component, supporting our Women and Children's Alliance, supporting Catch and Jesse Tree and others, and coming together in most recent years on helping stand up New Path community housing for those who are chronically homeless. So I will pause there. Happy to take any questions or talk more about this later.
Thanks a lot. Thank you very much, Jen. We are getting to the end of our time, and there are just a couple more folks I'd like to hear from and let you all hear from. The first is Robbie, who is going to give us a little insight into how we prevent homelessness from happening in the first place and the services available there. And then I'd like to turn to Andrea to talk about how do we bring housing alongside the services that our community is providing, and conclude. So thank you, Allie.
Thanks, Ellen, and thanks everyone. It's really, really fun and encouraging to hear from everyone and see your faces. We've all been working really hard on these efforts together, and it's fun to see it all come together. So in terms of preventing homelessness, we know what works. One thing that is really helpful is providing people with rental assistance when they're in a housing crisis at a place where they just can't pay their rent for whatever reason. That's something that's happening to more and more of our neighbors as the cost of housing goes up, because more and more people live paycheck to paycheck, and any unanticipated expense or shortfall can lead a family to a place where they just can't pay for rent. So rental assistance really helps. Jesse Tree provides rental assistance. Housing Authority is on this call, Deanna Watson, and as well as IHFA provides rental assistance for prevention as well in the community. Jesse Tree also couples financial assistance with supportive services, case managers who work with clients one-on-one directly through their housing crisis, providing them with landlord mediation, as well as connections to benefits such as American Rescue Plan benefits, employment, jobs, and connections to other resources that the family might need to maintain housing stability. We also do a lot of work with landlords directly one-on-one in ensuring that there's a good communication stream between the tenant and the landlord, and that their relationship improves as we help them. And the goal is always to keep them in their housing. Sometimes that's not possible. So if the tenant needs to move for whatever reason, then we'll work with them to find a new place to live and support them in providing security deposit assistance. We are also now supporting folks who are informally housed. So a lot of people in our community who are living in hotels or motels or doubled up with friends or family, and we'll support them with providing a security deposit, basically to prevent them from entering shelter, having to live in the car or their streets. And finally, we do a lot of work in eviction court. So we partner really closely with our courts in Ada County and the mediators who provide some services in court. We try to intervene in as many cases directly in eviction court as we can. We know that prevention works. In our community, over 97% of the people who've been provided with rent assistance and supportive services during a housing crisis are still housed. And we can see that through the data that we share with Our Path Home.
Thank you so much, Allie. And to wrap us up, I'm going to turn to Andrea Roop, who has been so successful at so many housing projects, not only in Idaho, but many other places. So Andrea, could you speak to how do we keep housing supply moving forward alongside our homelessness services?
Well, this is a really important component because we see it as a valley-wide issue, and housing supply is definitely a key component. And we see this as a huge public-private partnership. Just looking at everyone who's here today, it isn't solvable by government alone. And we did away with public housing a long time ago because it wasn't working, and it requires the private sector to come in and work to help provide affordable housing. And that's what we do. So in addition to being the developer and owner of Our Path Home, we have additional land next to that Our Path Home that we can possibly expand that and be able to provide those supportive services for permanent supportive housing. But as you've heard here today, it's not just about permanent supportive housing. There are homeless families that just need an affordable place to live. And that's really where supply comes in. And we own about 900 units here in the Valley. And we work very closely with Our Path Home and Catch to place families in those homes with supportive services. And we are really hoping through our campaign to end family homelessness that other landlords will also come to the table and not necessarily provide free rent or free units, but provide units and set them available for Our Path Home and Catch to rehouse these families with supportive services and with that case management support that keeps them in home. It's a really critical piece because it also disperses our poverty-stricken population throughout our communities. This is not just a Boise problem in a certain Boise neighborhood. This is a community problem, and we want our neighbors to be housed. And with proper case management support, nobody even needs to know that there's a previously homeless person living in their apartment complex. And we want these families to be in mixed income neighborhoods so that our children of these families can be successful and break this cycle of poverty. It's just critical. So our efforts working with cities and the counties throughout the Valley, Canyon County, Caldwell, Nampa, Garden City, Boise, Ada County. We have a affordable senior family housing project in Eagle. We also have multifamily housing in Eagle. We work to purchase a mobile home park in Eagle that we can redevelop that area with additional density and house people in mixed income neighborhoods. We're currently undergoing a survey of available land in the Valley that is most suitable to develop affordable housing. And we're looking at about 30 or 40 sites in the Valley, and we're continuing to investigate where that best location is to increase this housing supply. We have projects going on through the redevelopment of Meridian City Hall, where there's more apartments being built there. So everyone is coming to the table. The city of Caldwell worked with us to rezone some property in a major transportation corridor to add an additional 500 units to our inventory. So we're really working proactively to be able to make this happen for our Valley and to be able to end family homelessness and serve those adult individual homeless families as best we can through inventory, permanent supportive housing, and case management. So we're very excited to be part of this partnership. And we really believe that both personally this family homelessness is really setting our city on the right path and away from some of the failures that we see in other Western cities and throughout the US.
Thank you. Thank you, Andrea, and thanks for ending on such a hopeful note that and a note of possibility. And I know I speak for everybody within the partnership and who was part of this panel when I say that the time is now, and what we are laying out in front of us is entirely possible to do, especially with all of you who have tuned in and all of the partners that have come to the table. It's very inspiring to see this demonstration of community support at every level. I would like to thank you all for hanging in there with us. And as we conclude, mention that many of you signed up to participate in breakout discussions that are happening immediately after we end this panel here in just 1 minute. When you registered, you should have been sent a link to join those breakout discussions. And so we will be moving into that portion of our program right now. So I just want to say once again, thank you all for being here. Thank you to all of the panelists. And we look forward to seeing you in the